Imagine. Imagine waking up one day to some mild joint pain. Perhaps you take some medicine to help with the aches. The pain becomes increasingly worse, and coincidentally, so is your ability to breathe. You develop chest pain. It becomes severe alongside the pain you've been experiencing all day. You decide to go to the emergency room. You're given pain medication that is only slightly helping, and you are placed on oxygen due to your work of breathing. How do you feel? Scared? Confused? Anxious? Sad? Now, imagine experiencing these symptoms multiple times a year. This is often the case of those with sickle cell disease when they are suffering from a sickle cell crisis. What is sickle cell disease? Sickle cell disease is defined by Mayo Clinic as an inherited disorder of the red blood cells that create a sickled shape resembling a crescent moon. The abnormal cell shape results in poor oxygen levels in the body and becomes stuck in smaller blood vessels, causing pain. There is high risk of systemic blood clots and pulmonary emboli, or clots in the lungs. Sickle cell disease is most often seen in the African American population. A complication of sickle cell disease is known as a sickle cell crisis. This includes symptoms such as severe pain from the sickled red blood cells becoming dislodged in small blood vessels, acute chest syndrome with severe chest pain, and priapism, or painful and persistent penile erections. Treatments of sickle cell disease include pharmacological and non-pharmacological interventions. Pharmacological treatment includes opioid and non-opioid medication. An article states that combination therapy is effective because they focus on different receptors and pathways for pain management. Non-pharmacological measures can also be used in pain reduction. A randomized controlled trial by Kazak and Askarman shows statistical significance in pain reduction when utilizing non-pharmacological interventions such as progressive muscle relaxation exercises. Providing a controlled, quiet environment with adequate lighting and temperature can also aid in pain reduction. Patients learning to ground themselves by focusing on this environment can also lead to reduced pain as well. Patient experiences. Effective care for sickle cell patients can be difficult, as evidenced by many poor experiences within the hospital setting. In a qualitative study by Dial et al., 15 African American adults were asked about their hospital experiences with sickle cell crises. Negative responses from patients included, "I felt like that love and care wasn't there, and I was being mistreated." "Busy, lack of communication, trying to discharge me as soon as possible." They are thinking a lot of us are pill searching. In another qualitative study by Carvalho et al., 25 participants, predominantly African Americans, shared their negative experiences in healthcare, including, the nurses would say, "You again? What do you do that you don't get well from this pain? Everybody else gets better and you don't. Every day this boy is here. We give him medicine. It seems he's addicted to medicine." Doctors saying that we are drug addicts, morphine addicts, that the pain is not as much as we say it is. In a correlational descriptive study by Carroll, 19 clients, primarily African American, reported that sickle cell pain is severe for at least the first 3 days of hospitalization, and discussion suggested that there is room for improvement for healthcare providers to ensure effective pain management for sickle cell crises. We as nurses can provide effective and therapeutic care by educating ourselves, understanding the pathophysiology as well as the clinical manifestations behind the disease, and recognizing nonverbal cues of pain alongside of verbal. Pharmacological and non-pharmacological measures, such as the ones previously mentioned, can be administered to ensure best care. What else can we do as nurses? Shillington et al. States that we need to understand that pain is subjective to help effectively care for the sickle cell patients. And Zenwa et al. Explains that we need to be kind. They state, Patients with sickle cell disease who perceive healthcare justice from physicians or nurses use different pain coping strategies than patients who perceive healthcare injustice from physicians or nurses.